Hello everyone, I am Dr. Sujata DS from Dr. Agarwal's Eye Hospital, Kalyan. So today I'll be talking about cataract, what are the symptoms of cataract and the investigation we do to confirm the cataract and obviously the treatment modalities for the cataract. So what does cataract basically means? It just means that if there is any opacification of the lens or within the lens in the eye, so which causes opacification of the lens, that is basically the meaning of cataract. The word cataract is derived from the Greek word called as cataracta, so that means waterfall. Cataract is one of the leading causes of preventable blindness in the world. And according to WHO, that is World Health Organization, age-related cataracts are responsible for 51% of the world blindness. So, what are the symptoms of cataract? So, usually we get a lot of patients in our outpatient department coming to us with complaints like, Doctor, we're having gradual, painless, progressive loss of vision since few weeks or since few months. And usually, most of the patients are not aware of it unless and until it is affecting both the eyes. So they would also complain of complaints like glare, photophobia. So they would say, Doctor, we are having difficulty while looking at the sunlight, or we're having difficulty while driving in the night. And they would also give history of changing glasses too often. Like there will be changes in refractive error. They won't be comfortable with their present glasses. They would say that we had just changed the glasses 3 months ago, but we're not comfortable with it. So sometimes there will be abnormal color perception also. And some patients would complain of seeing white reflex in the pupil when the cataract is too dense. And occasionally, when the cataract is too dense, the patient might complain of seeing double images, or we call it as diplopia. So, what are the risk factors of the cataract? So, obviously, the main risk factor of the cataract is aging. So, just like how when we age, our skin gets wrinkled, the same kind of chemical composition changes in the human lens also happens. So, that leads to the opacification of the lenses, and that causes the formation of cataract. So, yeah, age is a very important factor, a risk factor. And other risk factors like some associated ocular conditions, like when the patient is having myopia. Myopia, that is short-sightedness. So since childhood, when the patient is history of wearing too high number of glasses, so they tend to develop cataract a little sooner. And occasionally, when the patient has some retinal issues like retinal detachments and gives history of undergoing some retinal surgeries, and sometimes patients with history of retinitis pigmentosa, they also tend to develop cataract sooner or later. And occasionally, ocular infections like herpes, that is viral infection, or uveitis, also leads to the formation of cataract. So that was about the ocular condition which leads to the formation of cataract. So the other factor, common factor which we see is toxic factors. So when the patient gives history of chronic exposure to the ionizing radiation, or gives history of chronic steroid usage, cigarette smoking, chemical burns, and sometimes nutritional factors. When patient gives history of poor nutrition or obesity, they also tend to give rise to cataract formation. Sometimes physical factors like blunt trauma, history of blunt trauma, undergoing any history of trauma in the eye, that also leads to the formation of cataract. And UV radiations in sunlight and X-ray is also a risk factor for the formation of cataract. And the most important risk factor for cataract, which people often tend to neglect, is systemic disease. So patients who are chronic, diagnosed chronically with diabetes mellitus or renal disorders or musculoskeletal disorders tend to have the formation of cataract sooner. So that was about the risk factors of the cataract. The other thing is, what are the different types of cataract? So obviously, there is one form of cataract called congenital cataract. So I'm sure with the word congenital, people would know that it's the formation of clouding of lens that is usually present at birth or later. So basically, it means that during childhood, you tend to develop cataract. And almost 33% of these cases are idiopathic. Idiopathic means that there is no apparent causes for the formation of these kind of cataracts in children. And sometimes there could be some hereditary causes as well. And some maternal factors, like when pregnant mothers give history of usage of corticosteroids and steroid usage during the pregnancy, or when they have history of infections like rubella or toxoplasmosis during their pregnancy and exposure to radiation or malnutrition. All this would give rise to the cataract formation in a child after birth. So, and the other factor is fetal factor. So, when the child has some oxygen deficiency during birth, or there is another birth trauma involved, malnutrition, and sometimes we associate it with other congenital factors as well. So that was about congenital cataract, which is seen in the children or childhood. And the other type, which is a common type, is an acquired type. So in acquired also we have the most common type is senile cataract. So with the word senile, it basically means old age. So here obviously the main risk factor is age. With the age you tend to develop cataract. So usually people around the age of 45 or later more than 50, they start to developing lens changes in their eye, and then eventually leading to the formation of cataract. And other type of acquired cataract is because of chronic exposure to the UV radiation, some dietary deficiencies or dehydration, smoking, and there is something called as pre-senile cataract. So pre-senile cataract is something between the age of 30 and less than 50 years of age. So usually when the patients who are a known case of diabetes mellitus type 2 or type 1, they may tend to develop cataract sooner. And history like atopic dermatitis, myotonic dystrophy, or some hereditary causes could also lead to the formation of presenile cataracts. And third important part of cataract is traumatic cataract. It usually develops after an injury to the eye, but this can take several years for this to happen. Unless and until the trauma is too intense, then the traumatic cataract can develop very soon as well. And the other form of cataract is radiation cataract. So this is formed after a person who undergoes radiation treatment for cancer chronically. So that was about the type of the cataract. So what all diagnostic tests do we do when a patient comes to our OPD with history of defective vision? So the first important test we do obviously is to take the proper history. What are the complaining history of the patient? And then after that, we do something called a Snellen's visual acuity test. So this basically measures the patient's vision. We check the refraction, and after that, we dilate the pupil and we see the patient, evaluate the patient in slit lamp examination, and do the anterior segment and the posterior segment evaluations. The anterior segment is where we can see the lens or any other cornea issues. We can rule out cataract in that. And posterior segment is basically retina evaluation. And once you diagnose cataract, we do a test called as A scan or biometrics. So basically, it's just a measurement of the dimension of the eye. So each human being has different eye power. So we need to check what kind of power lens we should be putting in the patient's eye after doing cataract surgery. So what are the pre-operative assessment which we do? It's like obviously ocular history. We take a good ocular history because patients with known case of glaucoma or any retinal issues or like retinal detachment, history of undergoing any intravitreal injections for the retinal issues or undergoing any kind of lasers. So we need to rule that out because that would help us in diagnosing what kind of cataract it is and how we should be approaching it. And the other kind of history we have to take is systemic history, like I mentioned earlier. Patients who are known diabetic, they're more prone for cataracts. So, diabetics or patient with history of chronic usage of steroid or any other medications. So, this all gives us an idea what kind of a cataract is and how we should be approaching it. And other is the ocular investigation, like I told you. Once the patient comes, we check the visual acuity, we do the slit lamp examination, we do the fundus evaluation, and then we do a couple of tests to measure the power of the eye and other rule out other ocular pathologies also. And in the last, we advise the patient to undergo laboratory investigation in case the patient is a known diabetic. So we need to keep a check on how the sugars are under control or not. So about that, and what are the indications for cataract? So when do we decide when to operate a patient? So not all cataracts we would advise right away for surgery. Sometimes when the patient presents to us and the cataract is too early, so we tend to usually wait because cataract keeps on growing. So there is no medicines to cure the cataract as such. It will just keep on growing. So if we feel the cataract is too early or there is just age-related changes, we can advise the patient to keep a close follow-up in case if the patient is complaining of defective vision within 1 or 2 months, then accordingly we can evaluate and decide about getting operated. But otherwise, the most important indications for cataract surgery is when the work or the lifestyle is affected by the vision problem which is caused by the cataract and glare which is caused by the cataract. So patients would usually, especially male patients would usually come to us and they would say they're having difficulty in driving. So they're having difficulty while going out in the sunlight. So that is hampering their day-to-day routine. So in that cases, we would go ahead with the cataract surgery. And when the patient complains of double vision, whenever he's seeing some distant object, and obviously the most important thing, the patient when the patient notices a big difference in the vision when you compare one eye to the other eye. So that was about the indication of the cataract surgery. And how do you manage the cataract? So like I told earlier, if the cataract is too early, we can just manage the patient with glasses. We can ask him to wear glasses, start doing his work in better lighting. And suppose if the both the eye or one of the eye is having a significant cataract, we can advise the patient to undergo cataract surgery. So suppose if the patient is having both eye significant cataract, we would advise the patient to get one eye operated. And then depending upon how that eye is recovering, we would advise the patient to undergo the other eye surgery within a week or within months, according to the patient's cataract growth. So it's not like we don't do both the eyes in one day. We do, but it's for the patient's safety and how patient is recovering. So accordingly, we can plan the both eye cataract surgery. So what are the different types of surgeries for cataract treatment is? There are obviously over the years multiple procedures have come, and right now the most common type of cataract surgery which we do is femtolaser cataract surgery and phacoemulsification cataract surgery. So both of these are the what do you say, the most commonly done procedure for the cataract treatment. And obviously there is other cataract surgeries like ECC, it is extracapsular cataract extraction or intracapsular cataract extraction, which we don't perform anymore, where we manually express the cataract outside the eye and then we place an intraocular lens or leave the patient away. That depends on the patient's condition. So, like I said, the femtolaser and phacoemulsification surgery. So, what is the difference between that? So, in phacoemulsification surgery, we use something ultrasonic power. So, with that, we are able to efficiently emulsify the cataracts of any hardness. So, with the help of rapid motion of the phaco-tip, which basically creates friction or heat. And in femtolaser cataract surgery, what we do is with the laser guided machine, we can get an accurate capsular access. We can get a precise incision made by the laser ready for the surgeon. And that eventually leads to the reduction in phaco power and time. And that is better for the patient because why there is faster recovery post-op. And in this femtolaser, what happens is that laser machine only fragments, gives multiple fragments of cataracts and makes the job of the surgeon very easier and that helps us emulsify the cataract very soon. So obviously there is reduction in the machine time. So what do we do before before pre-op? What are the pre-op instructions we would ask the patient before cataract surgeries? We would advise the patient to obviously get all his systemic parameters under control. And if he's a known diabetic or known hypertensive, we would ask the patient to keep it under control. And then once it's under control, we can suppose if we fix the surgery date. So we advise the patient to start antibiotic eye drop a day prior to the surgery and ask the patient to continue it on the day of surgery as well. And we also advise something called as non-steroidal anti-inflammatory eye drops, so which basically helps the patient's eye to reduce inflammation during surgery and after surgery as well. And we give some mydriatic drops, that is dilating drops, on the day of surgery, which will help us in give us a better view of the eye. So cataract surgery, we have come a long way. Like earlier in the earlier part, when we used to do our ICC or ECC, manual incision cataract surgery, there we had to make a large incision on the eye, and manually express the eye. So this all procedure is kind of a traumatic experience for the patient also, and obviously the recovery is also very slow. So in those times, we had to, give injections. We had to patch the eye. We had to stitch the eye. There used to be a lot of bleeding, a lot of pain post-operative. Patient can't resume his work promptly. But with the latest modalities like paper emulsification and temperature, there is no injection. We don't do injections in the surgical time. We just do a surgery on topical drops, like eye drops. This eye drop when patient doesn't feel a thing. And there is no stitch involved, there is no patch. The patient doesn't have to wear any patch after the surgery. The patient can just, get up from the OT table and just wear a protective glasses, and which he can continue wearing it for another 15 days just to protect his eyes. And the most important thing, there is no pain involved. Patient doesn't feel a thing. So most of the time, people would think, oh, with the drop, we would have pain. But it's not like that. With the drop, the patient won't feel a thing. They won't feel any redness, and patient can resume his work very promptly. So, what are the expected standards? Like, what are the goals we tend to, we want to achieve after cataract surgeries? The most important thing is obviously to improve the quality of vision, immediate restoration of the vision, minimal or no spectacle dependence. The patient doesn't have to wear any glasses, and increase the mobility and independence. Like the patient doesn't need to, need to rely on somebody else to do his or her day-to-day routine, like going to the washroom alone. Because when you have cataract, when you have dense cataract, it just tends to, hamper your day-to-day routines. So with the cataract surgery or with the latest form of cataract treatment, you don't have to depend on anybody else. Patient can start doing his or her work very soon after the cataract surgery. And the most important thing is relief from the fear of going blind. There are different, so in cataract surgery also, so it's just, in cataract surgery, what we do is with the, the laser or with the paper emulsion, what we do is we basically emulsify the cataract. And emulsify is basically the machine inside the cataract. And once you remove the cataract, obviously we need to replace that natural lens from in our eye with an artificial lens. It's not that it's not putting a lens. We have to put an artificial lens. Then the patient would be able to see properly without the glasses. So in the lenses also now there are a lot of lenses which has come over the year. So one of the most or the first kind of intraocular lens which has developed was monofocal IOL, that is intraocular lens. So what is monofocal? Monofocal basically means that we don't need to wear glasses for our distant objects. The patient doesn't need to wear, after the surgery, the patient doesn't need to wear any glasses for his distant vision objects, but obviously he'll have to wear glasses for his near vision. And there's something called as multifocal. After once the monofocal was developed, and there's something came in the market like multifocal. So what is multifocal? Multifocal, it means the patient doesn't need to wear any glasses for the distant and the near object. So basically it just gives the patient full freedom to do all his work properly. But in some cases, multifocal patients, they had difficulty in seeing the intermediate vision. So then came the lens called as trifocal, so which helps us seeing all these three kind of vision, like the which helps us seeing properly the distant objects, the near object, as well as the intermediate vision. So we don't need to wear glasses for any of these three kind of visions. So sometimes so this was all about monofocal, trifocal, multifocal. But sometimes some patients would have something called as astigmatism in their eye. So what is astigmatism? Astigmatism basically means that some people they tend to have cylindrical power in the eye. So cylindrical power in common term we say the patient has a Tera number. So the Tera number, what happens in normal eye when you see all the images in a straight position. In astigmatism, they tend to see the images in a slightly slanted, images. So to treat that also, we found a new lens that we call as toric cataracts. So this helps us in correcting the astigmatism in cataract patients. So the patient would have better visual acuity after visual quality, basically visual quality after the cataract surgery. So in rare cases, we do use some lenses called as iris law. But that was just basically the whole summary about cataract. Okay, so with this, I would like to conclude my talk about cataract, its treatment. And I hope whatever I had said, the symptoms and everything would help you all in, what do you say, identify any symptoms which you or any of your family members have, and which make you all visit an ophthalmologist and get your cataract done. Like I told, cataract is one of the leading preventable blindness of the world. So yeah, so if you all have any questions, you all can start posting in the chat box. So first you need to get your mom's BP and sugar under control. And what you can do is get your mom for an eye checkup. And first you need to rule out whether it's actually cataract, because not all blindness can be cataract. It can be some other issues also, like you told your mother is having diabetes. So sometimes it could be because of some retinal issues also. So you need to first get your mom, get an eye checkup, and then meanwhile, the same time get her BP and diabetes also under control. So you can't avoid cataract in the first place. Like I would have mentioned in the earlier stage, it is just an aging process. So if it's an age-related cataract, you would develop cataract in your later part. The what you see the avoid any complication. What you have to do is anyone who's above the age of 40 must always undergo eye examination every year just to rule out any other conditions. But there is no treatment as such for cataract. Yeah, getting a cataract is normal if it's age related also. And I had given some factors, risk factors like, chronic usage of steroid or some ocular infections or some other exposure to the ionizing radiation. But yeah, once you develop a cataract, I mean, it is normal. It is normal anyway. How to determine if one eye is ready? Obviously, you need to come for an ocular examination. Then the ophthalmologist can determine when the cataract growth is significant enough for to get operated. But yeah, without the ocular examination, it is not possible. Uh, how to detect is obviously you need to get your eye examination done every once you cross the age of 50. get your eyes examined every once a year, or if you're especially suffering with some kind of systemic diseases like diabetes mellitus or hypertension, the best way to avoid its progression is get an evaluation every 6 months. But there is no medicines, if that's what you're asking, there is no medicine. Yes, according to some studies, there are some, multivitamins that they suggest that it helps in reducing the progression, but as such, none. Yeah, so again, like I was mentioning, it depends on which kind of intraocular lenses you would be using during your surgery. So if you're using monofocal lenses, you would be required to wear glasses for your near vision, like when you have to see your mobile phones or read newspaper. But if you're using trifocal, then no, you don't need to wear glasses. So it depends on. So there is nothing like this company is good and that company is bad. Nothing like that. So obviously we tend to advise, after seeing a patient, after evaluating a patient, which patient is suitable for monofocal or a premium trifocal. But there's nothing like one particular company is good like that. If that's what you're asking. So if you're not comfortable, sir, then please do counsel. You can get a second opinion also. There is no harm in getting a second opinion. You can just get evaluated. Kalamoti is basically the matter is matured to its last stage, and the only solution for it is to get it operated as soon as possible before it gets. So again, like I told you, that we can determine the appropriate time we can determine only after the examination. If you would have noticed in the indication for cataract surgery, when I said it starts affecting your day-to-day routine life or your vision is affected, that's the or you start having glare or photophobia. That's when you start, that's an indication for you to get your cataract removed. Post recovery care, yeah. So post recovery care, what happens usually the patient can start using his mobile phones or TV from the day one also. But yeah, if you say rest, there is no bed rest as such. The patient can, if the patient can take rest for a week at home, because what happens post surgery, the medication is the most important part. So what happens when you start going for work from the very next day? Patients often tend to not put medications. So that might lead to a slower recovery. So we always, as doctors, we always advise the patient to take at least 1 week rest at home, and then yeah, you can resume all your work from the next day also. But there is no bed rest as such. You can resume all your work, provided you're putting all your medications. Okay, so I think I've not cleared all your doubts and you have gotten a basic idea about cataracts. And I thank this opportunity for giving me an option to talk about cataracts. So thank you.